Hey, Dr. Lindsay, this is student Dr. Zach Fitzgerald presenting a case today. I just had 62-year-old female Miss Michaels come in with some knee pain that she was complaining about, of about 1 week's duration. She pointed to the side of her knee when I asked her to localize the pain, although she said it was usually more diffuse and less concentrated. She described the pain as just soreness and constant, about 6 out of 10 at the time of examination. She didn't have a surgical history, although she did note that she passed some kidney stones about 5 years ago, and she presented to the clinic today with some reasonably significant hypertension as well as gastrointestinal reflux disease, for which she was taking a hydrochlorothiazide diuretic as well as some Tums when that GI upset became worse. She didn't note any drug allergies, and she let me know that her father passed away at the age of 82 a couple of years ago from a myocardial infarction, and during his lifetime he also experienced some of the same knee pain that she was experiencing at the time. She let me know that her mother, 87, is doing well and is healthy, enjoying her retirement. In terms of the food that she eats, she said she eats a relatively balanced diet for the most part, although does like to indulge in food and alcohol from time to time. She let me know that last night she was out having a couple of beers and some seafood, specifically some shellfish, to which I noted that change. She is married to her husband and lives at home with him in a monogamous relationship. Together they own a painting company and are busy at work with that. In terms of just her general symptoms, she denied fever, chills, fatigue, weight loss, or weight gain. In terms of her dermatologic condition, she had some warmness over the knee itself that she was complaining about, but nowhere else on her body. And no rashes, bruises, or lesions, anything of the like. In terms of just her musculoskeletal system, she did not have any back pain, muscle pain, or joint pain other than the joint that she came in complaining about, which was her inflamed right knee. I was able to perform a physical exam for her and examined all of the collateral ligaments as well as the cruciate ligaments, and didn't notice any significant changes of note there. I did also perform a McMurray's test for her meniscus and was not positive either. With the relatively unremarkable physical exam, I suggested that we do an arthrocentesis today, to which she agreed. I explained to her the indications, contraindications, as well as potential complications of doing such procedure. And together we both decided that it was a good idea to go ahead and do that. I was able to aspirate a good amount of fluid off her knee. It was purulent and crystalline, so I sent that off to the lab for examination. When I got the results back on that, it was pretty evident that we were dealing with a gout diagnosis, and that monosodium urate crystals were causing her the pain that she was experiencing. Because of that, I took her off her hydrochlorothiazide diuretic and suggested that she make some changes to her diet, including limiting alcohol and cutting out some shellfish and red meat for the time being. For the pain, I gave her a hydrocodone acetaminophen tablet, as well as some prednisone, and explained to her the relative complications which could arise from those. In terms of osteopathic manipulative treatment, I was able to examine her fibular head today, did not notice any dysfunction there, and that did not seem to be contributing to her knee pain at all. In terms of tests, I sent off the knee aspirate, and I also had a nurse come in after I left the room to collect a couple of blood samples and just run some more generalized tests to make sure everything was taken care of. She said that her husband was able to take care of her at home while she was dealing with the pain, and also help her acquire those prescriptions from the local Walgreens, where she said she'd like to pick up from. I referred her over to her primary care for gout management going forward, potentially look into taking her off of those acute drugs which I prescribed her and get her on a more long-term solution to reduce her monosodium urate levels in the long term. She didn't have any other questions for me, and that pretty much took care of the rest of our visit. Thank you again.